Biochemic cell salts. Biochemic comes from the Greek word bios. And chemistry, obviously. Chem is chemistry and all of the laws of chemistry that apply. Biochemistry deals with causes, and I will explain that in a little bit, and the law of supplying deficiencies or depletions. You'll make the connection when I get through the subsequent slides. I want to share what Dr. Schussler, who's the founder of cell salts, believed. 12 most essential mineral salts that our body contains are crucial to our health. The correct balance is normal for cell function and maintaining healthy body. Now, if the balance of these minerals are disturbed, then disease will follow. I go back to what Deborah Bruce said yesterday about water consumption or hydration and dehydration, or overconsumption of water, which causes water toxicity, and you feel like you're doing everything right. You're dieting, you're leading a healthy lifestyle, but still something is not right. Well, when you have mineral salts or cell salt deficiencies, all sorts of problems are going to arise. And guess what? If you take vitamins and supplements, those vitamins and supplements are not going to be absorbed for your benefit if you are deficient with cell salts. What are cell salts? They are the vital building blocks of tissues and cells. They supply deficiency in tissues and trillions of cells that make our body. Now, we know about cells, right? Because we're human beings, and we know every cell in our body vibrates at a different frequency. They form the basis of blood, containing all the material for tissues from capillary vessels, arteries, veins, tissue and organ which supply nutrients and oxygens to every part of the body. Then we've got nerve, muscle, bones, cartilage, mucous membranes. They're all dependent on what? On the correct balance of the molecular motion of these salts. Any disturbance, just remember, any disturbance in the equilibrium or the stability of these cell salts will result in abnormal conditions. And I repeat again down here, remember, if you do take vitamins and supplements, but you are mineral deficient, those vitamins are not going to be absorbed. In fact, I ask a lot of questions from people when they say, well, I'm taking all the right vitamins, I'm taking all the right doses, but I still, how about minerals? Check your minerals, and that'll be a starting point. I know a lot of you have heard about electrolytes. Lord knows the marketing you've got the powder, you've got the liquid, you've got everything you put on. But then electrolytes only contain 4 minerals. They call it essential as well. We've got calcium, potassium, magnesium, and sodium. And then any deficiency in any of these will cause an illness. But the same applies with cell salts, except cell salts have much more. And we are working with those 12s that we're going to be talking about today. And just to remind everybody what those electrolyte imbalances are when you are deficient in these 4. Calcium are all the calcs in cell salt. Potassium are all the calis in cell salts. Magnesium is mag, obviously. And the nats are sodium. And look at the conditions each. And you notice there's a synergy. And it's just these 4. Reminder, cell salts work with different principle in homeopathy. They are not remedies because they are not derived from plants or animals. They are chemically pure salts, homogeneous to the cell minerals in the human body. Homogeneous, similar to the texture and the working method in our body. Cell salts do not target the vital force. If you're familiar with homeopathy, homeopathic remedies do target the vital force, which is the energy life force in our body that allows the body to heal itself. Cell salts don't do that. They can't do it on their own because they have to make sure that you are not deficient in the mineral cell salts before vital force takes its path and starts healing you inside out. Cell salts are not selected according to the principle of similarity. If you're familiar with homeopathy, a major comment here is that like cures like. If you have a cough, you take a cough remedy that's made from a cough source. If you have nausea, you take Nux vomica, which is made from another source that's similar to that. So like cures like does not apply to cell salts because we're dealing with deficiencies. Cell salts do not, and look at the beautiful list here, they don't cause any aggravation, they don't cause any proving, and they definitely don't cause any side effects. And for those of you who are taking drug medications, let's not go into the brainwash stage of our mind where we're so used to allopathic medications that we're worried whether this combined with that is going to reduce its efficacy. It is not. Examples of where body utilizes cell salts. Look at that. Nerve cells, magnesium, potassium, sodium, and iron. How many of us are deficient in iron? A lot of us, especially if we have thyroid condition. Muscle cells, again, magnesium, potassium, sodium, etc. Connective tissues, we know what those are. Those are our fascia. Those are our geometric fascia, the nerves that run from head to toe. Silica. While the elastic tissue of the cells, there's calcium fluoride. The bones, major. Cartilage and mucous cells, potassium, which also occurs in all solid and fluid parts of the body. Our lymphatic system. Brain, nerves, connective tissue again, calcium phosphate. Hair and crystalline lens, the natural lens located behind the iris, colored part of the eye. Iron is very, very critical. That's also part of the cell salts. Examples of when to use cell salts instead of remedies. Thyroid problems, sleeplessness, insomnia. Pain relief, high fever, liver detox, heavy metal detox, allergies, cough, exhaustion, and fatigue. What this should remind you of, if you have any of these conditions, I always say not limited to because it's just an example of a few. If anyone has any of these conditions, don't let your mind go into remedies or conventional drugs. Go with cell salts first. You'll be amazed at what it does to your body. Examples of when to use cell salts for prevention of, top of the list, Alzheimer's, Parkinson's, these are all muscle-related, Alzheimer's, myeloid-related, thyroid disorder, hormone-related, high blood pressure, blood circulation, diabetes, osteoporosis, heart disease, and liver disease. Now let's take I'm not going to read through all of this, but I would like for everyone to look at the organs that are related to each cell salt, along with the deficiency symptoms. And why do I say deficiency symptoms, but not just symptoms? Because they're not homeopathic remedies. They're not based on symptoms presenting themselves in your body. They are there to show you that you are deficient in these minerals that you need to replenish for your body to function properly. We start with the first one, calcium fluoride. Bones, vein, tooth enamel, throat, larynx, thyroid, tissue elasticity, and strength. And look at the examples of the deficiency symptoms that present themselves if you are deficient with calcium fluoride. Nails, brittle, splitting, cracking skin, sweaty feet, etc., etc. I'm not going to go through all of this, but this is here for your information. Calcium phosphate, bones, teeth, blood, periosteum, the bone covering, spine, muscles, cartilage. And look at the deficiency symptoms if you were deficient in calcium phosphate. Another one is calcium sulfate. We dig into the organs now. Liver, gallbladder, heart muscles, bones, tissues, connective, mucus, and best as blood cleanser. I highlight there, calcium sulfate is a key component in the production of fibrin, which supports skin tissue and blood clotting. If anyone is on Coumadin or warfarin, well, guess what? You've got calcium sulfate that you may be able to take along with it and slowly wean off of it, because this can handle that. Yes, calcium sulfate. Boils, abscesses, wounds, acne, eczema, yellow pus, contact dermatitis, burning, itching, inflammation, tonsillitis, and so much more. But pay attention also to eczema. Anyone who comes to me with skin issues or skin questions, I have to look at minerals in the gut first, because skin is the last resort that your body's signaling you for attention, and finally emerging through the skin. It's like, take care of this. I couldn't handle internally. Now I have to expose it. Take care of it. We've got now, well, we finished the calciums. Now, we all know we don't supplement with calciums, right? But you can with cell salts, because they're not just plain calcium. You've got the fluoride, you've got the phosphate, so those are okay to take. And of course, if you are getting your calcium from foods, then you'll know exactly what to take supplement-wise with your D3 and K2 and the magnesiums, so that it transfers that calcium-enriched food you just ate into your bones and muscles and joints where they belong, and not in your bloodstream, so they may not cause any kidney stones or arterial calcifications. We go to the potassium chloride, glands, bronchioles, lung airways, COVID, throat, mucous membranes, eustachian tubes, muscles, joints, shoulders, and look at that. Potassium chloride is the mineral worker of the blood that forms fibrin, the fibrous protein and property which diffuses it through the tissues of the body. Again, for those who take Coumadin or warfarin, here's your answer. But never, never stop your drug medication just because Alice said, go take potassium chloride. Always, always go low and slow and test your body and see how it talks to you. Potassium phosphate, energy regeneration. Nerve tonic, spleen, muscles, skin, temples, mucous membranes. And some of the deficiency symptoms that it may present itself: poor gum dental health, nervousness, which I am not now, depression, anxiety, stress, anger, weak memory, tension, headache, mental exhaustion. We've got potassium sulfate, your respiratory organs, lungs, glands, mucous membranes, pancreas, liver, skin, pigmentation. And what do you have here as for symptoms? Possible thyroid medications. Anyone who's taking thyroid medications must have depletion of potassium sulfate. But are you aware of it? Does any doctor check for it? When you go to the lab, do they say, oh, shall I check your potassium sulfate? No one does that. Bear this in mind. Liver old age spots, brownness of skin coloring, high fever, vitiligo, freckles, eczema, sinusitis, psoriasis, and asthma. Again, we're talking skin conditions emerging because it couldn't heal itself internally. Magnesium phosphate, antispasmodic, restores energy, heart, colon, nervous system, regeneration of nerves and muscles. And look at the symptoms. Best mineral for cramping, pains that come on suddenly, that are sharpshooting, painful periods. Insomnia is here as well. Recurring headaches, stuttering, chocolate craving. Anyone you see who's crazily going after sweets, deficient in magnesium. My son was like that until I started feeding him magnesium glycinate at night and giving him magnesium phosphate. Now, I have a short story on this magnesium phosphate. Why is every child born get colic the first 3 months that they're born? Well, let's go back before birth. When the mother is getting ready and is in labor, she's going to have a lot of cramping, contractions, excruciating abdominal pain. She's becoming deficient in magnesium. That's why she's having a lot of cramps. Well, since the mother and the baby are still attached, guess what the mother is doing? Taking the reserves from the baby's magnesium. And here, the happy baby, born and a happy camper, but then is deficient from all the magnesium reserves. So for the first 3 months, he's going to have colic. Hopefully, the mother won't do the wrong things. She'll know what to give. We've got colic comfort out there. We've got magnesium phosphate to give. That's if they had this information and knowledge to work with. And why do we say the first 3 months? Because through breast milk and breastfeeding, it'll take them about 3 months for them to replenish what the mother used at childbirth. Potassium chloride, energy regeneration, restoration of fluids, digestion, connective tissue, stomach, brain, blood, you name it. And those are the deficiency symptoms right there. dandruff, dryness, dry cough, loss of smell or taste, high blood pressure, cracking joints, sinus, sunlight sensitivity, constipation. Sodium phosphate, mucous membranes, very critical to get everything directly into your bloodstream. Perhaps I neglected to mention the method of, I'm going to get to the method of administering. I'm rushing it a little bit. We've mentioned mucous membranes quite often. So when you do take it physically, physical dosing, it has to go under your tongue, where the largest mucous membranes are found. And as they are dissolved in time, they will go directly into your bloodstreams. Sodium sulfate, we've got the organs here, major gut organs, liver, gallbladder, pancreas, and colon. And look at the deficiency symptoms. We've got swollen hands and feet, depression, suicidal feelings, bloating, itchy skin, eyelid bags, and detox impairments. And last, we've got the silicea, connective tissue, bones, skin, nerves, hair, nails, glands, bones, cartilage, and eustachian tubes. And the deficiency symptoms include feet, light noise sensitivity, again, nails, you've got splinters, general skin problem, immune issues, all internal, shy person, cold body, smelly armpits, immune issues, boils, abscesses that are not discharging yet. Just this hastens the pus formation for quick release. Here are some of the examples for emotional symptoms of cell salt deficiencies. I'll let you absorb that for a few seconds. Calcium fluoride, indecisiveness, weakness, low self-esteem, stress on finance matters. Now, dear people, you don't have to memorize this. Lord knows I haven't memorized it. But we have it written down so that you can take this information and use it as you need it. Calcium phosphate, desires to travel, loss of motivation, mental weakness, difficulty handling bad news. Calcium sulfate, you've got fatigue, laziness, inactivity, worried about imaginary problems. It's like anticipatory anxiety. You've got ferrin phos, our iron, overly stimulated, followed by dullness and feelings of emptiness. I didn't get anywhere. You've got the potassium family with irritability, dealing with family issues, homesick, panicky, nervousness, and again, weak memory, tension, moody. All of these are potassium deficiency related. Magnesium phosphate, sensitive, outgoing nature, complaints regarding physical problems, and impulsive. They've got it all. We've got the sodium family, depression, isolation, control issues, sun sensitivity, deep greed, and forgiveness issues. And the silicea, you've got the shy person who lacks passion, who lacks perseverance, but they're hypersensitive and then sensitive to cold. How to administer mineral cell salts. So for physical dosing, you may dissolve anywhere from 1 to 4 tablets under the tongue. My motto is always go low and slow. Start with 1. Assess how your body is absorbing. Is your body telling you anything? Then increase it. So your normal prophylactic physical dosing for these cell salts is up to 4 daily. Now, you have, as I mentioned earlier, it has to be taken sublingually because that's where the largest mucous membranes are. And they get activated there and directly into the bloodstream. You can also take few sips of water. If you put it under your tongue and allow it to dissolve, and you take a sip of water, then what's going to happen is these minerals, they're going to pull that and directly impact it pull that water directly into your cells. So not only do they go through your bloodstream, but your cells are just getting replenished right there and there. Don't just chunk water down. Put the tablets under your tongue and take a sip. Enough for it to pull it out and dump it into the cells. Frequency dosing, piece of cake. You can imprint it onto a blank pellet, or you can use a cell salt frequency, or you can put a shot glass on your fractal amplifier and just put your cell salts. Philosophy behind these minerals. If your body's minerals are depleted, and no lab work will show any of them, be assertive in asking your physician too if you need to. Your body will give all the signs through the deficiency symptoms. Go back and check the deficiency symptoms of each cell salt. That will trigger for you to get ready to talk to your doctor. These minerals cannot be too high or low. In both situations, your body will produce symptoms. If excessive, then you need to detox. If deficient, then you need to replenish with the minerals. Replenish and restore with the deficient mineral cell salts, and the symptoms, will go away before you've even reached into your drug medication or even a remedy. That's the beauty and the power of these cell salts. You can't go wrong